Hi everyone, this is Sandra Berry. I am going to be discussing my self-teaching pain plan for this patient. As a new mom, I do feel like it'd be beneficial to know which type of delivery she had. That can significantly change the perception on how pain could be. Moms who have C-sections are, of course, in a lot more pain than mothers who deliver vaginally. Um, for pharmacological treatment of pain, I feel like for this mom, she expressed her concern that ibuprofen causes an upset stomach. And in the hospital, a lot of nurses fail to go over medications such as ibuprofen and Tylenol because they're over the counter and they're not prescriptions, so they don't really think to discuss the side effects and provide any teaching that go with these medications. For me particularly, I know that ibuprofen can cause an upset stomach and should definitely be taken after eating something and should never be taken on an empty stomach. So, for this mom and the nurse in this particular situation, I feel like she really had an opportunity to provide education on ibuprofen and ask her, when she takes ibuprofen and it causes the upset stomach, is it because she's taking it on an empty stomach or does she eat something beforehand? Um, and maybe it was just something as simple as that the ibuprofen should be taken with a meal. She could also let her know that usually when you're discharged after having a baby, your ibuprofen dosage is a little stronger, and ibuprofen is really a great drug for inflammation and for pain, so it works wonderfully after having a baby. The second thing to this is that there are actually a lot of non-pharmacological ways to manage pain after having a baby. And the first would be ice packs or cold packs in the peri area. Those can really help with swelling and discomforts that new mamas are having. A new thing, I guess it's not quite so new, but just in the last couple of years, they have started using dermoplasty, which is a spray that they spray on a peri pad or on a cool pack, and it helps to numb the peri area just for a brief time. But I feel like any time is beneficial for new mamas, especially when they don't know what type of discomforts to expect. So the dermoplast you can spray on the peri pad and apply it with each time she uses the bathroom, and it doesn't increase chances for infection, any of that. It just kind of helps numb the area in addition to using a cold pack. The other thing is that kind of bracing yourself or splinting your abdomen when you have to cough or sneeze, because a lot of pressure can be really uncomfortable for those first few days after you've had a baby, regardless of whether it was by C-section or a vaginal delivery. Another thing is that if the non-pharmacological methods are not successful and ibuprofen's not successful, or the upset stomach is not caused by lack of eating meals when taking the ibuprofen and she does need a different drug, then she could discuss with a doctor maybe not a Percocet or a narcotic, but something a little stronger, maybe an Ultram or a Tramadol, which are kind of both midway between the ibuprofen and a Percocet. Of course, when you're giving any kind of medication, there should be side effect teaching and taking the medication, anything that you should take, whether you should eat before you take a medication or certain things you should eat or drink before you do or don't take the medication. I think a lot of nurses do their best to provide this information to patients, but in this particular situation, if she has a known history with drug use and does need to go home on a narcotic, then teaching her to only take it when necessary, and discuss it with the doctor. Maybe the doctor will only prescribe a couple of pain tabs, but truly, I think for this, the best things to do would be, for this particular mom, would to be teaching the non-pharmacological management, like the ice pack and the Dermaplast, and then going over the ibuprofen, and that she can alternate ibuprofen and Tylenol. And oftentimes those are really enough for moms that have had vaginal deliveries. So I think the best thing here is just to provide the education and not brush off and just say, oh, you have ibuprofen to go home to. There are a lot of things that new mamas can do that they just don't know about that make a big difference when it comes to pain management after having a baby. So it's all about getting that information out there and educating them on what's available to them.